A 65 years old man present with 5 centimeter ulcerated area over his middle malleolus. It has been present for many years, and the nurse have complained that it is not healing with simple bandage. What is the best course of action? That means a 65 years old man present with ulcerated area, which is the middle malleolus, but it present many years. So this point is very important, that it present many years. That means it is not malignant, it should be benign. And but there is the bandage, simple bandage there is no response. So what is the best course of the action? So what we can do, we go for investigation or we go for the surgery. So this point is very important. One is the, we should go for investigation or we should go for surgery. First of all, let's see the options. Here the options are: perform a core biopsy, perform a punch biopsy, arrange split thickness skin graft, undertake an incisional biopsy, and arrange for wide local excision and skin grafting. So we have to find out one of the option. Here we can see this is an ulcerated area. In case of the 65 years old man present the longer time, and what we go for the next option. Here we can see a biopsy procedure which is known as the punch biopsy, and here we can see the punch biopsy. That means a small hole, but it can go a deeper area because it has a longer part. So it is possible to take the tissue from the proximal and distal portion, that means from the superficial and from the deep simultaneously. And punch biopsy, what is it? It is used for diagnostic confirmation that are suspected to benign. That means a lesion which may be benign. In this condition, there is punch biopsy usually done, and where the definitive management is unlikely to be surgical, and where definitive management unlikely to be surgical, that means where surgery may not require. In this condition, punch biopsy is appropriate. Of limited usefulness of pigmented lesion, where they are not include sufficient tissue for accurate diagnosis. So in case of pigmented lesion, this punch biopsy should not be done, and may be used in non-melanoma type of the skin disease to establish diagnosis prior to more extensive reaction. So in case of non-melanoma type skin disease, the punch biopsy may be done. But in this case, punch biopsy may be done because it is a longer time of the duration and there is no symptom of the recent onset malignancy. That means when a lesion suddenly increase its size, when there is increased pain or itching or suddenly discharge or bleeding, in this condition there is suspicion of malignancy. But in this case, not such type of the suspicion, so punch biopsy may be option. So here we can see this is the punch biopsy. So punch biopsy should be done in this case because it is the years, many years. So in case of many years, it is usually it should be benign. On the other hand, there is no recent changes of the lesion. For this condition, as it is the benign, so we should go for the biopsy. So biopsy first, not for the skin graft or definitive surgery. We should go for the punch biopsy first in this